Hello.
Hi.
Good morning. Good evening. I don't know what to say anymore, but okay. Everyone, welcome back to the second session of the day of the program actually. So my name is Wibool Piyawattanametha, live from Thailand, and my co-host is
Velia Siciliano from Italy. And today we are hosting the second session of the panel Beyond the Boundaries, COVID-19 and Global Health. So first of all, I would like to thank all the panelists to be here and also for whoever who couldn't make it. And I also want to give a bit of introduction to the people that couldn't make it the very first day. So this panel belongs to the main theme of this conference, which is Heal the Earth. And our objective is to try to understand the impact that our behavior and the government behavior is having on the planet, and how we can sustain new actions in order to prevent that some emergency, such as the pandemic of COVID-19, can happen again. So this conference encompasses everything that relates to climate change, biodiversity, pollution, and also some other thematics that are emerging even more and even more strongly with the COVID-19 pandemic, meaning inequalities at the social, educational, and economical levels. So we had already a first day of a nice and productive discussion with our panelists that led us to a document format. But today, the point of this second session is to translate into action the discussion that we have had. Wibool, I hand it to you. Next.
Thank you, Velia. So just to follow up from the first day, we're gonna show you the same format of the presentation. So we like to thank the funders or cooperating partners. The first one is the Inter-Academy Partnership, UNESCO, Gordon and Betty Moore Foundation, Indian Young Academy of Sciences, and Leopoldina, and Federal Ministry of Education and Research. Next.
Also, we are recording this session, please consider that if you want to ask questions to the panelists, you can provide your question in the Zoom chat, and so we will turn them to our guests today. And if you go next. So this is the beautiful speakers of today. Wibool, do you want to introduce them?
Sure. So the first one, we have a very strong lady from UK, Clarissa, Rios, Rojas. The second panelist is Toni, Gabaldón from Spain. The third person is Chirasree, RoyChaudhuri from India. The fourth is Ibrahim, Sidi, Zakari from Niger. The fifth is Sandra López-Vergès from Panama. And we have Huanyu already, Cheng from the US. Next is Diamond from Nepal. And Gregory Todley from UK. Unfortunately, Gregory, he's on call, so he couldn't join us for today. Just to keep you all posted. And the last one is Daniel Limota from Canada. Back to you.
Thank you. If we can go to the next slide. Okay, so that's to explain how we structured this panel for today. For whoever has contributed to the discussion in the Google Doc that you see on your left, thank you very much. It was a very fruitful discussion and very inspiring. And this has brought us to ask some main action topics that you will find in dedicated breakout rooms. So we start by asking some leftover questions from the last session to the panelists. And meanwhile, breaking out rooms are being created so that we will dedicate 25 minutes to the breakout room. Each of it will have a leader who will report later on. And this will be followed by the panel discussion. So it's really important to remember that we, based on the discussion of the Google Doc participation, we have created very specific questions that will be listed next, and where we want your input, because we want to have, what we want to have at the very end of the day is some actions that we as member of GYA can implement in order to prevent new possible emergencies. So if we go to the next slide, please. Okay, so we are gonna have 3 breakout rooms and possibly another one, we will see, since we have many questions and many interesting topics. So the first breakout room, we try to answer in a very proactive manner to the following question. How has the pandemic affected the ongoing research on various fields in different countries? Has it stalled the progress? The breakout room number 2 will relate on improving the communication between scientists and public. So what can we do to improve communication with the public and stop the distrust towards science? In the breakout room number 3, we will try to make into action the answer to the following question: how have different countries handled the pandemic with respect to scientific evidence? What could be improved? What did countries do well? Can you identify best practices? And this is a very important question also because we, with the emergency that we are experiencing today, we know that we might have even more in the future. So we need to be prepared. And then in the last breakout room that we might create later on, the question is what can be done about pressure on the people working in the scientific community or anybody in general during the pandemic. And so this relates mostly to the work that scientists have been greatly involved in the COVID-19 pandemic, but also to the people that are directly impacted by the social and economical issues coming from the pandemic. So the main question for all breakout rooms is what are the next steps for young scientists, and why as organizations like GYA and NYAs? What concrete action can be taken? And if we go next, I think with this, maybe we can start. So I again invite you to post new questions in the Zoom chat so that we can address them to our panelists. And I would like to Wibool to start with some questions that we had from the first panel meeting. Thank you.
Thank you, Velia. So this question is actually from some of the audiences that we had from 2 days ago, specifically asking about the situation in Spain regarding the pandemic. So the question reads, what has been the reception in Spain regarding the detection of coronavirus in sewage as early as March 2019? Toni, can you answer this question?
Yes, can you hear me?
Yes.
Okay, well, this is a reaction has been a bit full of a bit of a skepticism because this finding will be very surprising, and so some people has put some concerns regarding whether this could be a false positive and that this needs to be reproduced before concluding that the virus was already here in March 2019, because this will involve, if it was here, it will involve it was also in many other cities and circulating for a long time. So so far the reaction has been, okay, this is one result. In these days also many preliminary results jump suddenly into the press, and I think we should put them, all these results, in quarantine for a while to see whether they are confirmed.
Thank you. Great. Velia, you want to ask next question? Microphone.
Sorry. So we had a question for Larry who couldn't join. So I will move to the next one.
Easier now.
Easy?
Yeah.
Okay, great. Larry, are you here with us?
Yes, I'm here.
Oh, great, and welcome. So we had a question about the monitoring of COVID-19. So what vital sign can be monitored using wearable technologies that you were mentioning in your video for detecting COVID-19? And what will be the specificity of this test?
Sure. So here we have actually a lot of different parameters can be monitored. And when we get to talk with the physicians in the hospital, they don't actually have a really specific parameter at this moment, but they use the so-called early indicators, which include the heart rate, respiration rate, trends in the blood oxygen levels, and consciousness, heartbeat, and blood pressure. And one particular parameter they are interested in is the cough, but it's not the clinical parameter at this moment yet. But they just mentioned it's a critical parameter to look at, maybe something they would like to study in the clinical trials, maybe just to look into in the near future. But of course, this is not at the stage to be served as the diagnostic confirmation for the disease application. And that's why they bring up a lot of interesting ideas for us to continue. And I think that would be really, really helpful, because we do see a large trend of this outbreak not ending in the near future. And that will just be something we would like to study in the continued research, and also welcome the community to jump into the research for this type of question. And that would really be helpful if we join the effort and forces together and to tackle this grand challenge for the developing and even the developed countries as well.
Thank you.
Great.
Very good. So we're gonna ask one more question before we move to the breakout room. So this question will go to Daniel Limota. Daniel?
Hello? Yeah?
Yeah, hi, Daniel. Okay, so the question is this. So during these recent COVID-19 events, a lot of research articles have been retracted after being published, even from a well-known prestigious journals, that lead to trust problems between scientific community and the public. How we can return back those trusts to the scientific community?
Hi, thank you very much. That's a very good question. There have been some retractions in very good journals. I might not say that many retractions. I cannot tell you exactly the number of these retractions, but it has been like on the news and in the media. The trust in scientists during this pandemic has been challenged in many ways, and the retraction is one of them. I think that one of the ways in order to get back this trust to the public could be to doing solid science. In that regard, everybody has to be collaborating, not only the scientific institutions, but also governments, and also even the media has to be kind of collaborating with scientists as well. At some points, you can see that the media can be taking a side in these debates of the trust of science. But I think that one main point would be try to gather all the strength of all these parts of the society, not only the scientists, but the non-for-profit organizations, research institutions, governments, and other institutions of the government, in order to support the scientists in these very, very hard times of the pandemic. That's what I might say.
But that's a very good point about the collaboration and making solid science. I think that's a key statement that everyone should actually, embed it in their head when they do good science. It will never come back to be a problem or go good, but at least you try. Very good. So, Velia, back to you.
Yeah. I think it's about time to start to take action and to move to the breakout rooms. And then, we have 3 breakout rooms, and in the Zoom chat, you will find the link that will bring you to the document where you can choose the breakout room you are most interested in. 4 rooms, I'm sorry. With no further ado, we can move there, and we will be back in about 25 minutes, where the leaders for each breakout room will report on what action we may take as young scientists on the different topic that we are discussing. Thank you.
So, see you in a bit.
All right. I think we are all back here. Actually, 30 minutes is never enough because it was so good, the discussion that we were having, that more time would have been great. So, Wibool, shall we start from the breakout room session number 1? So, we are going to have the wrap up from the leaders of each breakout room session. And this will be first point for the following discussion.
4 minutes, please. Time timing.
Oh. Hello, can you hear me?
Yes.
Okay, in our breakout room, we were discussing what the next steps for young scientists and young scientist organizations like GYA and the National Young Academies, and what concrete actions can be taken. They are very, very challenging questions and difficult to answer, but we were doing our best. We were discussing that one concrete action is to foster collaboration between the different academies, and also between government organizations and funding agencies and young academies, trying to allocate funding to do solid research in these pandemic times that will be increasing the trust on young scientists during the pandemic, to continue to release statements as the GYA statement on COVID-19 that will be showing how the academies are involved in this fight against the SARS-CoV-2. That's a summary of what we were discussing.
Thank you.
Perfect.
Thank you very much, Daniel. That's very interesting, and that's something that we will bring up later for the discussion. And then next breakout. So before going to breakout room number 2, for all the participants, please don't forget that if you have new questions that are coming out of these new discussions, you can just post them in the Zoom chat. Breakout room number 2, Sandra.
Okay, so the question was, what way to improve communication with the public about the pandemic and public health? So one first thing is to work really since childhood on science literacy on the overall population. So when they're adults, they can understand more what scientists are saying. We have to work more with media so they cannot confuse messaging, and they can, explain about scientific uncertainties. So how can scientists respond to these confusing messages? We could maybe work together with journalists to educating about science, like workshops together. And this is something GYA and national academies can work on it. So us as scientists, we need to be more honest about the uncertainties, but also clear about consensus and our knowledge and how this can help them in the crisis they're living, for example. And again, always explain the scientific process. And this will help us to convey comfort, even if we're explaining that there's uncertainty. And when we are science advisors, we need to be clear about what is advising, what are the potentials, the limitations in the political process, what are the clear boundaries, so they understand that we cannot be the solutions for everything. So again, we can maybe do scientific policymaker hackathons together. And one important thing from Meghnad from Nepali was also to always work with policymakers to make them understand the important messages that this disciplinarity, diversity in science will help research communities and government plan strategically a response for a specific crisis. Thank you.
Thank you.
Splendid. So the next, number 3, Robert.
Hi, everyone. So our group was tasked with the question, how have different countries handled the pandemic, and what can be improved, and what did countries do well with respect to integrating scientific evidence into policy. Quite quickly, we spoke about the real big dreams and things we want to see, like global openness, like sincere openness. We talked about the difficulty of building ventilators in less resourced places around the world. We talked about the difficulties of drug access, the big ideas how to de-link drug prices from the cost of doing research to create these drugs. And more concretely, we thought about, okay, what can we do as a GYA? And one thing that we noticed is that there are other actors like INCSA, the international group that deals with the international network for government science advice, who has this big database that compiles global experiences about the take-up of scientific advice for government around the world. And our suggestion would be that we as GYA write a small blog, 300, 400 words, about how open science is a cross-cutting issue that is of benefit for all different aspects related to COVID-19. So in short, write a blog for this big consortium. And yeah, then we discussed a little bit about open IP and IP issues, open science, and the role of, and also looking forward, what could be future topics for GYA about not just drug development, but also equitable drug distribution. So lots of different justice aspects connected to COVID-19.
Mm-hmm. That's an interesting point that also Luis Davidovich had brought up in his videos. So how can we make sure that also access to drugs does not suffer inequalities? Okay. So next breakout room. I think the moderators were Toni.
Do we have 3 or 4? We have 3.
4.
Yeah, 4.
So for our room, Chirasree was going to be the presenter. So.
All right. So there is an immense pressure on the scientists for finding out possible solutions for this pandemic. But of course, to navigate through this pressure, one of the possible solution is whenever the scientists present something, they should come up with their limitations and the uncertainties. That whatever they're proposing, that's not the ultimate. There can be certain percentage of errors, because when one has to do everything within a limited time, then of course there will be mistakes, and so it's better to come up with the tolerances and the uncertainties. And of course, to navigate through pressure, one has to say no to some of the cases. If one is asked to find out a vaccine or a drug in a very short time, that's of course not possible. So that has to be admitted, and policymakers should be able to appreciate that instead of just unnecessarily pressurizing the scientific community. So the limitations should be accepted, and it should be conveyed properly also to the common masses with the help of the academics. So what really the scientists, young scientists and academics can do, one of them is to bridge the gap between the scientists, journalists and the governments, and also to explain the methods of the transmission of a particular pandemic in a layman's term to common public. And in this way, science communication should be also encouraged.
Perfect. Thank you very much. And I think we found a consensus that it's really important for us as scientists to fix this gap of communication that we have with people and with the media and with the governments. That's something that is basically that each breakout room was tackling at the very end of the day. And from my understanding, we should tackle this at different levels. So one is, as Sandra was mentioning, is educational. So if we start from educating kids, then we give them the means to understand what is the scientific mind, what are the scientific questions, and what are the uncertainties that science brings. And then we go over with the general public and then with the media and indeed with policymakers and government. Now, based on this discussion, I would like to ask a question that to all of you, and whoever wants to chip in is very welcome. So how does science is low. Answers needs to be given very fast, but in a time in which we cannot provide fast answer, the priorities, for example, of the governments are more toward other issues. So, for example, with the economical collapse because of the lockdown, now there is the other pressure where we need to open everything because otherwise financially we won't keep it up. So whereas the COVID-19 has told us that we should implement a long-term vision that is of more sustainable economy, green economy, keeping biodiversity, stopping deforestation, and so on and so forth. So my question for you is, how do we reconcile the need of building up our financial system again with a long-term vision that is more sustainable and that will prevent new emergencies like this one of COVID-19 to happen again?
Please make it short. How about Method? I haven't heard from you yet. Just start from you first. Are you still there, Magnet? From point of view in Nepal. Yes.
Can you please once rephrase the question? I just lost a little bit.
Yes.
And I'll answer.
So the short version of this question is that COVID-19 is prompting us to towards a more green economy where we take care of biodiversity. But now we are facing a financial collapse. And so basically the governments will just bring all the economy back up again. So how do we push towards this long-term vision of a green and sustainable economy?
Okay, thank you. From the Nepalese perspective, I think it's not really a very bad impact because we are a mountainous country and more dependent on natural resources. Like 80% people are still dependent on the agriculture. So compared to the developed country, the impact is quite low, I'll say. And if you see the impact, and that means mostly impact are only in cities, big cities. And even in the big cities, the pollution level has drastically reduced. So we are now within the WHO standard. That's good news. But the bad news is that especially for the poor, urban poor, it's a big problem and challenge. And I'll say it is one opportunity for the developing country to be developed, because most of the people who are in abroad as a like for like means education or for the labor, they all are returned back. So they may join in the natural farming and other things, and they can boost up the economy. That is the one part. But the second part is that our if you see the epidemiology of the COVID-19 in Nepal, our worst affected people are the young, means people of the economically active age people. Like 85% people are between the age 10 to 14 years. Fortunately, our mortality is very low, less than 0.4%. That means very low compared to the other country. And cases are asymptomatic. Only like less than 2% cases are symptomatic. So from the disease treatment and management perspective, we are facing big challenge because most of the people are asymptomatic. But from the economy side, except for the cities, for the rural area, it's good because the people get back to their home and they had like the abandoned field, like agriculture land. Now they are getting used, and we are reaching the biodiversity like for forest, like 45% country land is covered by the forest. Now, if we can make like some types of green economy using the herbal medicine and that, I think this is an opportunity. So from the developing country perspective, I'll say we have both opportunity as well as challenge from the economic perspective.
Great.
Thank you.
Does anyone, so maybe Sandra, you want to add some more to this?
Yes, I think what is a challenge is to show policymakers and the people that are in economy that this challenge is an amazing opportunity to make a new definition of development that would be more sustainable, and maybe where we will focus on other things. So I think, as Megdad say, depending on the country, it will be easier or not to hear. Because if his country is more on agriculture, I think is the perfect setting to try to do a development in a sustainable way for all. In a country like mine that is commerce, so we depend totally in commerce. So we are 100% extreme capitalist. That's a really difficult way to explain that. How I will make these people to think of middle and long future for generation. This is really hard because they want to think of tomorrow. And yeah, so this, I think this challenge will depend of how is the economy of each of the countries. So some of them will be easier to take this opportunity. Others maybe will take a little more difficulties to give these opportunities. I don't know if you saw it, but when we were comparing the opportunities of only having education through informatics, through computers, and compare the poor people of that country with the richest people of that country, there was always a difference. But this difference was really small for some countries in Latin America, okay, like Uruguay, let's say, or Chile. But for Panama, we were one of the biggest, because inequality here is really high. Even if we're the richest in Central America, that's not important because our inequality is too high. So how in a system where inequality for them is not really a problem, because you have really labor that is really cheap, how you make them understand that this is not good for sustainability.
Yeah.
That you need more, you need something more social, where education, science, and health are more important for all. You have to be really careful to say that. This can be say, okay, you're only, we are some of our countries that dream about Trump and Bolsonaro, even if we, so how do you say something where you can explain that thinking of other, being social, doesn't mean in a way extreme, but trying to find this equilibrium of individuality and collectivity is the answer for the humanity in the future. How can you explain that in settings that we're still thinking of 20th century, that if you say something social, even minimal social, that will be sometime from the center in Europe, here that will be extreme left, and you will have big problems because you will be categorized as communist and nobody will hear you, no matter if you have good ideas or not. So how we can have discussions so you can take ideas from all people and make them understand that all these ideas could maybe help to have a new society that don't exist, that you don't need to compare to what has been done in the 20th century. This is really difficult, I think.
And that's where leadership also plays a role, also political leadership, because countries where there's still like debate whether the virus is a problem or not. I mean, we know what's going on over there right now, right? And those are the action that will affect the next step for each country.
And those are really big countries, so their effect is really strong. They're the two biggest countries in our continent.
Yeah.
They're the head of the north and the head of the south. So how do you do that?
Wow. That's very specific, Sandra. I mean, I couldn't know what countries are those. Yeah, I guess. We coming to very close toward the end of the session here today. I like to ask maybe one last question, perhaps, but we're gonna go to every speaker that we have here. I think we only 2 left. Am I correct? Oh, Daniel, one more, maybe 3. So this question is it's probably could be very specific or non-specific. So what, in terms of this pandemic here, which has globalized it, how does it affect your research? I mean, how does it help improve your research quality, decreasing? You can talk about this, maybe just 1 to 2 minutes each, maybe 2 minutes, 1 minute each. Please go. Tanner, yeah, go. You want to go first?
Go first really fast. Okay,
Yeah.
for us as virologists, it's an opportunity because it's increase of funding and increase of visibility, because nobody care about that, and now everybody know that is important. So this is the opportunity. And the negative part is because we're rushing to do everything fast. There's a problem of quality, as was already explained before. So how you can give fast answer, keeping quality, and making it like opportunity and not like kind of crazy competition, who does it first.
This is great. Magnat.
Yes, like the Sandra mentioned, this is an opportunity. Like a scientist, me, I am like interdisciplinary scientist, so I'm working on the different aspect. The bad news is that especially the effect on the non-COVID health problems, like the maternal mortality, suicide, and others are increasing. So that's the worrisome for the country like Nepal. So I'll say the research from the other dimension than health are badly affected due to this COVID-19.
I see. Chiras? Chiras?
Oh, hi. Yeah. Since I work in the area of diagnostics, so it's sort of easier to get some funds now to work in the area of COVID-19. But again, the output has to be very fast in just 1 year of time to come up with an affordable diagnostic kit. So quality, gets hampered to some extent. And also the research funding in the other areas of science have actually decreased to some extent, which is not a very good effect. But I think it will slowly come up once the initial pressure of delivering something for this pandemic has reached a certain limit. Then definitely, I think the funding will be routed to the other areas also. So right now, it's easier to get funds in this area, and it's a pressure also to deliver something meaningful in a short period of time. That's it.
Toni, thank you.
Thank you. So for me, it's similar. There's also been opportunities to collaborate. We do genomics and comparative genomics. So we have used our expertise in some projects, but the downside, I think in these times of rush, there is a lot of duplicated efforts by many groups around. So there's always the risk of putting your group to work towards something and see the publication by a more potent group following week. And I think there is incredibly an amount of duplicated effort around the globe. And even within the same country, different foundations are funding for the same things to different groups that are then competing. So I think I prefer long-term vision, curiosity-driven science. So for me, this is not the best option, even if funding is increased, which is in a way is not increased because it's directed from other sources to this one. So I guess research on cancer or aging or other topics is being decreased at the same time. So there's no more money. It's the same money, but it's distributed differently. And I think less efficiently.
I guess we have all the speakers here.
I think also Daniel is here. Daniel, can you also give your comment?
Yeah, I agree with many of the comments of the previous panelists that today the funding have been distributed. The researchers directly involved in the COVID-19 research have been benefited with this. But other very, very important fields in health sciences like cancer, other kind of diseases, non-infectious diseases, they have been really affected by this, and it is very, very hard to predict when that funding will be returned to those groups. We are now trying to reach kind of a balance in the research of COVID-19 in order to avoid that repetition, in order to avoid science that is not solid. However, it has been able to be published. So it's very challenging at time for researcher during this pandemic. I really think that many fields have been suffering from lack of funding, and again, it's hard to predict when they are going to be recovered.
I see. So I guess in a way, to summarize, actually for the overall conference as well, I guess everyone agree that this kind of pandemic could create an opportunity and also a disaster to some areas of the research and also economically. And in a way, as young scientists, sorry, I'm not young anymore, I'm the founding member, but anyhow, you young generations, you see the problems that already happens, right, around the world here. And I think there's a way to fix it as long as we have strong, strongly emotionally, and support from friends around the world here, that we need to point out, right, the lack of some of the funding in some of the areas. Like everyone in my country as well, same thing. Some other diseases now have almost no funding to go toward. They put majority of funding to. I think it's happened everywhere, which is totally redundant. But to stay clear of all the politics here, that's why we have to unite it, right? To be one voice, one global voice around the world here, and help to point out the certain drawbacks and good points of being together. And that's leading to some of the blogs and also some of the short essays that we're gonna try to write to wrap up for this conference as well. Okay, I guess this is coming to an end. We have only 1 minute left. I like to give to Velia one more time, and then I'm gonna say goodbye.
Yes,
Velia.
I just want to say thank you very much for this productive discussion. I thank all the people who participated, and I want to thank the panelists for their amazing commitment both today and last time. And again, thanks to the office who helped, basically coordinated all of this. And yeah, so we are looking forward to put all this discussion into some specific actions that as members of GYA we can take. And with this, I will, so I'll cheer you and I say thank you again and have a great rest of the day or night, depending on where you are. Thank you.
Thank you. Goodbye from Bangkok.